Welcome back, class. We're going to finish this particular module up, and we're going to talk about the benefits of a healthcare data warehouse, and then we're going to talk just a few minutes about how providers can go about building their data warehouse. As far as benefits, and a lot of these benefits you will recognize from the benefits that we discussed when we were talking about on the payer side the last time when it came to the benefits of an information warehouse, because you're talking about reporting and analytical efficiency. You have a centralized informational warehouse that has access to integrated data from multiple sources. Remember, on the payer side, you were mostly talking about provider claims and member information. On the provider side, we're talking about just a more expansive amount of information, because a lot of it is driven by descriptive information, information with a lot more detail than what you may see on the payer side of the house. So if you think about the UB04 we talked about on the payer side, that information is aggregated. So on the UB04, it's aggregated by revenue code. If you're looking at the information warehouse on the provider side, if you're talking about a hospital, it's going to have line by line by line, and those revenue codes can have multiple lines, depending on how many days you've been in the hospital and how many types of services you've had per revenue code. So you've got just a tremendous amount of data on the provider side, especially on the hospital side, from multiple sources. You can optimize clinical decisions. You're, at least in theory, can improve treatment efficacy and maximize patient expectations. Remember, patients come to see a healthcare provider because they aren't feeling well, or they don't think they're feeling well, but they want to come to see a provider. They want a professional that's going to provide them some relief from a physical situation, from a physical malady. And so if you can use that information and that comes out of that single source of that information warehouse on the provider side, you can actually improve treatment efficacy. And if you can improve the treatment efficacy, at least in theory, you're going to maximize the patient's expectations and maximize the patient's utility. Remember, most patients don't go to see a healthcare professional just because they want to. They go there, it is a reason. Most people are going to go to the doctor because they have a reason to go. You have optimized payer billing and payment. Again, we go back to that clean claim. If you've got the information in a single source and the information has been vetted in that single source, and you can extract the information to complete either the UB04 at the hospital side or the HCFA 1500 on the individual provider side, then you can generate that clean claim. And as a clean claim comes in, remember, we talked about there's a pre-adjudication process in the life of a claim. There's an adjudication process, and then there's a post-adjudication. If you can clean up that information so that you can generate a clean claim in that pre-adjudication process, when it hits that payer system, during the adjudication process, it should speed it through the system and ensure that you get an accurate on-time payment if you're a provider. Also, benefits of a data warehouse, and we've brushed over this, kind of talked about it a little. You've got patient-centric experience and outcomes. Again, it goes back to mitigating asymmetric information, minimizing the patient, the principal agent issue, and increasing transparency for both the provider and especially the patient or the member that is coming to see that provider. It is going to be, especially not only now, but especially in the future, it's going to become more and more important for providers in the healthcare environment to be able to exhibit transparency, to mitigate asymmetric information, and minimize at least the perception of the principal agent dilemma. It creates a value-based and episodic care cohorts. When we talk about value-based medicine, you're talking about, especially from a reimbursement perspective, you're talking about providers being paid what they call a per member per month payment for a subset of services. So you go to see a provider, and that the service that he or she provides you is within this value-based realm, so it's driven by a CPT code, then they've already been paid for that, and they're not going to get additional monies for it. And to create that value, to create an equitable value-based reimbursement methodology, not only does the payer have to have that information to drive it, but the provider has to have information to drive it to ensure that they are being accurately reimbursed for those services. You can also, through episodic, care cohorts, let's say that the provider tells the health plan, if you'll pay me X number of dollars, I'll provide all of the services this patient's going to need for an artificial hip or a knee replacement. So you're talking about episodic care cohorts. You can do customized treatment plans. And again, you can go back to the value-based episodic case type reimbursement for healthcare goods and services. And if you can get to that point and with an agreement between the provider and the payer, it's better for the healthcare industry in general. And at least in theory, it's better for the patient, because the patient should get a standard set of goods and services for that particular episode of care. When it comes to building a data warehouse, and again, we went through some of these on the payer side, but from a provider perspective, the providers, whether it's a hospital, whether it's a multi-specialty group, whether it's something, go back to the mom and pop shop. Providers need to develop the objectives and the goals. They have to understand the functional areas. They have to understand the tasks that are required. They have to understand the customers that are going to come to see them. They have to understand the members that they're going to be providing healthcare goods and services for. Second thing you want to do is you want to determine the format and the location of the data sources. What's the data going to look like as it comes to the information warehouse? Coming from multiple sources, how are you going to store it in that information warehouse? Once you feed it into that information warehouse, what kind of format's it going to be? Because the format that it's stored or structured within that information warehouse needs to be fed into the government, to the data governance documents, and also into the data dictionary. So understanding the format coming from the source, understanding how you can manipulate that data so that it's stored in an information warehouse in a format that is conducive to the analytical outcome or the analytical processes that you're going to use. You have to determine infrastructure options. Do you build it internally using internal IT, or do you identify an experienced IT vendor? It's going to depend on the return on investment that you're looking at. It's going to depend on the cost-benefit analysis that you work through on the provider side of the house. Just like you'd have to do the same thing on the payer side of the house. It's just most health plans have so much more access to IT resources than maybe a provider's office does, or maybe a multi-specialty practice. Usually on the hospital side, even though they're using a canned type of electronic medical record like Epic or some other system, they may use internal resources to build that data warehouse. You have to identify the technology and the architectural design. What kind of technology are you going to use to extract the data? Are you going to use SAS? Are you going to use business objects? You're going to use Cognos? You're going to use some of the Microsoft tools, some Google tools to extract it. You're going to use Power BI. I mean, there's a lot of tools and technology that you can use to extract the data. And you need to have an idea beforehand what technology you're going to use to extract the data before you get into the architectural design, because the technology to extract the data has to match the architectural design. You have to develop and integrate. What are your development and functional teams going to look like? Because when it comes to developing that information warehouse, you have to have a plan in place. You have to have a champion. You can call them a champion, somebody within the organization that's going to champion this warehouse, and then that champion is going to organize both developmental teams, and they're going to organize implementation teams. And those teams are going to be driven by individuals from those functional areas that are going to be operating within the realm of that information warehouse. When it comes to deployment, do you deploy it on site, or do you, on servers on site, or do you deploy it on the cloud? And again, it goes back to functionality, it goes back to resources available, it goes back to the cost benefit analysis. One of the most important aspects that sometimes falls through the cracks, training and education. What's the warehouse functionality going to look like? How about how's the data dictionary going to be constructed? How's data governance going to be overarching over all of this when it comes to training and education? And how do you go about training and educating those individuals that are going to be playing in the sandbox that you call your information warehouse? And then lastly, you've got to have support and maintenance. What are the maintenance protocols? Again, maintenance, data governance, data dictionary, how often the information warehouse is updated, who does the vetting, who takes care of issues. All of this falls under that support and maintenance. And again, do you do it in-house or do you outsource it? And with that, that's going to wind up this particular module when we were talking about providers using their information warehouse. And the next time we get together, I think we're going to be talking about payment integrity. Talk to you then.